A major health issue, obesity is now considered a chronic disease. It's big news today as the American Medical Association voted to change the classification.
Should the Public Health Agency of Canada do the same? What exactly is a disease? Well, according to the AMA, it is defined by three things. 1. An impairment of the normal functioning of some aspects of the body. 2. Has characteristic signs or symptoms. And 3. Causes harm or morbidity. Obesity is defined as abnormal or excessive fat accumulation that may impair health. It is divided into three categories depending on the BMI. It can have a serious impact on the functions of the body. It has many defining characteristics and can cause harm to the person's physical and mental health. Therefore, from a literal standpoint, obesity fits the definition of a disease. Some argue that BMI is an insufficient measure of obesity and that we shouldn't label obesity as a disease without an adequate diagnostic system. Even if BMI did accurately measure body fat, they argue that fat alone doesn't lead to poor health. We propose combining more effective body fat measurement techniques like skin fold measurements with the Edmonton Obesity Staging System that combines physical measurements with other clinical observations to provide a fuller assessment of risk for obesity-related morbidity. There is physiological evidence that fat produces substances with negative effects on the body, contributing to disease like type 2 diabetes, demonstrating that excess fat alone does contribute to poor health. The defining obesity as a disease will have a positive social and individual impact. For one, the responsibility to get better will not solely be placed on the individual. This will force the healthcare practitioners to participate in the treatment of their patients suffering from obesity, rather than to dismiss their concerns since they supposedly brought it upon themselves.
If you have colon cancer, we take out the cancer, maybe give you chemotherapy or radiation, and we hope. But man, is obesity different. And though the causes of obesity are multifactorial like most diseases, no other group of patients experience the hurdles, the ridicule, and the punishment that the obese patient does. No other disease is associated with so much shame and loneliness. We support people with other diseases. We should also support those with obesity. Weight discrimination has increased 60% throughout the last decade, and healthcare providers have been shown to be among the worst offenders time and time again.
Secondly, this will legitimize the seriousness of the problem for the individual, and it will encourage the person to seek help in reversing his or her weight problem before they start to suffer from the serious consequences, such as type 2 diabetes and hypertension. Thirdly, it will help remove the negative labels associated with those suffering from obesity, which will help the morale and self-esteem of these individuals. Low self-confidence, isolation, and depression are often associated with binge eating.
So here's the thing. According to a new study published in the research journal Obesity, negative reinforcement about one's weight actually causes an average weight gain of 0.95 kilograms or just over 2 pounds a year, while people who receive no such comments lose an average of 0.71 kilograms or about 1.5 pounds a year.
Defining obesity as a disease would help the public, the individuals, and the healthcare practitioners take this illness much more seriously. The economic cost of obesity in Canada is estimated at $4.6 billion. However, estimations rise close to $7.1 billion when based on the costs associated with 18 chronic diseases linked to obesity. By focusing on treating obesity, we would see a reduction in the healthcare costs of these other comorbid diseases. Some would argue that labeling a quarter of Canadians as having a disease would put a burden on the healthcare system. However, we believe that it is a short-term cost for a long-term payoff. A common fear is that we would be medicalizing a problem that can be controlled by individual lifestyle choices. However, recognizing the complex and intricate biological and environmental causes of obesity outside of an individual's control is essential to reducing obesity on a large scale. People like to think that putting down the chips and getting on a treadmill would solve the obesity crisis. But unfortunately, it's not that simple. Although lifestyle changes remain essential for treatment, medical interventions may be necessary for some individuals to achieve long-term success.
We're treating a chronic disease. We use all the tools to treat every other chronic disease. Clinically severe obesity should not be any different.
In conclusion, we believe that obesity should be defined as a disease here in Canada. Defining it as such is likely to have far more positive than negative consequences and will benefit the health and well-being of Canadians.